All right, good evening. I hope that everybody's well. We're going to jump in and get going here. We appreciate you taking time this evening as we continue to attempt to answer questions as we look at the reopening of schools. Jenny Picard from our comms team will share just some very brief information about just kind of process here, and we'll watch our number of participants as we've gone on with these. As we would hope and anticipate, the numbers kind of decrease from the standpoint of the numbers that are participating in these, just because more and more information is getting out, which is a good thing. And hopefully more questions are being answered, which is a good thing as well. So we may be able to operate a little bit differently. But Jenny, you want to give just some standard updates on that?
Sure. So the way that this is going to work is Dr. Johnson is going to go through his presentation, and then after that, he's going to answer questions. And you can either enter your question in the chat box and it will go to me, and I'll ask the questions. But since we've got such a small group, it may work that you can just unmute yourself and ask a question. But regardless, you can still send your questions to me and I'll make sure that they get asked.
All right. Thank you, Jenny. All right, so we'll jump in and again leave plenty of time for questions. We've got several members of our team here on the call, and again appreciate each of you taking time. So as we look at the reopening of schools, three things that we are really elevating around this conversation is first and foremost grace. We ask that the community and parents and teachers have grace with us, and we want to have and show that grace in return as we deal with this unprecedented moment in time. We also heard very clearly that choice is important, and we value the ability to provide choice to and for families. And then thirdly, that this is a very fluid situation, and it's ever changing. 3 to 4 weeks ago, we had about 950 cases. And earlier last week, we had over 1,800 cases. And so the number just doubled in regards to active cases. And so, the information's constantly changing. Last Thursday or Friday, the CDC put out new guidance around reopening schools. And so this is a fluid situation that we're continuing to learn from and learn about. And then on Thursday, actually, we've I think nailed this down. I believe 5:30. Is that correct, Jenny? 5:30, I believe. We will have a medical focused town hall, in which we'll have 3 doctors that'll be available there to answer any questions. When we closed on March 13th, we never would have anticipated that we'd be here. And then, the other thing I really elevate is that, one, we want your feedback and questions and concerns. That's why we want to make sure we make this time. And then really there's no playbook for what we're working to address. This is it's really a worldwide pandemic that obviously has impacted our country, our state, and our county. And because of the, significance and enormity of the task, we knew that we needed to really dig into this. And so we established a task force, which we have several members of that task force here in the leadership here. Lieutenant Colonel Bill Brooks, who serves as our Director of Army Instruction, and obviously comes to us with a military background, understanding really how to operationalize and make sure we're being mindful of the processes that are necessary to be successful. Keith Fogelman, who comes to us from business and industry, but also has spent the last couple of years as our Chief Talent Officer over HR, that brings that lens to the work and making sure that we're supporting all of our employees as well as our students and teachers. And then Jen Bronson, who currently serves as our integrated supports and really deals with whole child supports for students and student success plans, but also is a lawyer and as well as has been a teacher. So they brought their expertise along with another group of community members and such, teachers, leaders, students, to really help us put together a framework. And these 4 principles stayed at the forefront of what they did. They started in May, and they really haven't necessarily concluded their work. There was a meeting as recently as last week, I believe, but they've continued to work through the time, but presented this reopening plan, so to speak, at the July 2nd school board meeting. The reentry plan has 6 components. You can see those 6 components. You can review the plan in its entirety on the district website. But make no mistake, as I shared with the group earlier, that reopening schools in the midst of COVID-19 has impacted our entire school district. in every area of our organization. And to that point, I want to be really clear that this reopening plan is a guide. It is a framework from which we'll look to work for, and a part of the state's expectation to have a continuous learning plan, but it's not a how-to document or set in stone. Go back to something we said earlier, that it is a fluid situation, and we're still getting in garnering information. One of the data points we use in regards to garnering information was direct feedback from our stakeholders, parents, students, employees, et cetera, and had phenomenal participation in that regard. Our first survey had over 25,000 respondents. This is a glimpse of our second survey, in which there are over 20,000 respondents, and you can see that the vast majority of those respondents, which is a good thing, were parents and guardians. And I always share contextually, on average, we have between 3,000 and 5,000 usually participants with our surveys, and so we've had phenomenal engagement in the midst of this process. And you can see from survey 1 to survey 2 that people have become a little more clear, or had become a little more clear at the time of this survey, in regards to what they felt was right for their children, but still a pretty significant percentage in the I don't know and no phase in regards to the return to school. And so we are sensitive and respect exactly where each family is in regards to that decision, and know that that was important as we looked at phasing and gating criteria. So to talk some through the phasing and gating criteria in regards to our own campus option, there are 4 phases. Phase 4 being that we're completely open. Phase 3 being that there is spread, maybe at isolated campuses, in which we close those individual campuses. Phase 2 being that the spread is more moderate, more significant, and that we need to look at a hybrid approach in which we can create more distancing opportunities, and students are in 2 groups, Group A and Group B, and would come on a hybrid approach, which we'll share more about that here momentarily. And then phase 1, in which we're completely remote, and all students are online because there is significant spread within our community. So those are the 4 phases in regards to the on-campus work that this team looked at. We really thought it was important to make our thinking visible, and again, commend the reopening task force, as well as our health department and medical professionals that helped us come up with this active case criteria that is our gating criteria that's used to move us through the phases. Again, we wanted to make our thinking visible, but it's not all encompassing, because there is consideration given to that middle box that's on your screen, that being the average daily number of cases, the average daily number of hospitalizations and ICU situations, as well as absences for teachers and students. Those are things that we'll continue to monitor, in addition to the active cases, as we try to make decisions. You can see the case count as of July 27, the number of active cases being over 1,800. And again, concern there about the number of cases that exist and how we operate within that context, and continue our work. And then what we've begun to do on a daily basis is to send out a daily update in regards to where our current status is and what's transpiring in regards to spread throughout our community. And so we can see that we're on the cusp of phase 2, and really right there at it in regards to a decision. And so it's going to be critically important that we do the things that we need to do as a community to ensure that we can open schools, and that our employees and students, et cetera, remain safe. And to that end, we know that the best practice is that that we wear masks and we distance, and that we disinfect and wash hands and do what is recommended by the CDC and other medical professionals. And you can kind of see in this graph that the likelihood of spread is extremely high if you have an asymptomatic COVID-19 carrier that comes in contact with an uninfected person. You can see how significantly that likelihood of spread is reduced if you're in mask and you're distancing and you're doing those things. And to that end, we are encouraging our parents and students to engage in the safe pledge, in which simply says you stay at home if you're sick, because of how we're structuring some things with online learning and such. Students will still be able to access curriculum. We think that's immensely important, that they avoid getting too close to others, that face coverings are a must, and that everyone wash their hands and sanitize surfaces. And so you'll see more and more about this. We began to communicate this over the last week or so. We'll continue to push this out and encourage our community to take part in mitigating against the spread of COVID-19. A lot of conversation about face coverings in phases 2 and phases 3. All students and staff are required to wear a mask in phases 2 and 3. Again, as we see the active case number continue to grow, it is important that we do all that we can as a community to mitigate the spread. And in K through 2, it is not required, but it is recommended that our students wear masks. We are taking some additional steps in K through 2, things such as partitions and such, to make sure that we support the developmental reality of a K through 2 student. We do know that the reality for students in grades K through 2 in regards to wearing masks, it is a little more difficult. So we're sensitive to that. And then obviously in our county, Hamilton County is under a mask order. And so it is required at this point in time. In regards to the academics, I talked a little bit about the 4 phases, and I've talked through kind of how the learning looks. Phase 4 being there's no spread and everybody's on campus. Phase 3 being that there may be specific sites that are closed. 2 being that hybrid, and 1 being that we're completely remote. We've always had a virtual option, which is at the bottom third of your screen in regards to option 3. And so we know that there's increased demand for that this year, and excited to continue to be able to offer that. But we also knew, and so to be clear, with virtual school, you are in essence opting out of your traditional school into the virtual school. We also knew that there were a significant amount of parents, and I'll show the data here in just a minute. I believe 32.1% of parents in our second survey that said, if there were a way for my child to remain connected to the school, I would like to engage in virtual learning. And so this year we're launching HCS at Home, which allows your child to remain connected to their home school, but also to get their learning virtually, because we know that there are many families that want their children to remain connected to the school, but also have uncertainty during this moment in time in regards to COVID-19. And so, I want to point out phase 2, which I'll go back and show was that hybrid approach where students are in 2 groups. What you'll see is that in phase 2, the student A would, a student in cohort A would come to school on Monday and Tuesday and would be remotely learning Wednesday through Friday. And then cohort B is the opposite. Monday through Wednesday, they are remote. Thursday and Friday, they are on campus. And then ACS at Home is completely remote. And then I point your attention to the middle of the screen there where you see Wednesday, and it's completely virtual, or it's a completely virtual day for everybody. And the impetus for that is to allow us to do enhanced cleaning of our buildings. I think I pointed out that about 32.1% of parents. So when we deployed the second survey, based on the data from the first survey, we knew we needed an enhanced virtual option or a different virtual option in addition to the virtual school because of the demand was there. And so we began to really socialize and get input around HCS at Home, and we got pretty strong demand and interest for HCS at Home. And so that was the impetus for us really trying to resource and support it. Again, I want to be clear, and I think this slide can be misinterpreted, that virtual is a strong option if you have ascertained from the time this spring that the virtual environment is where you feel like your child needs to be forever, for the foreseeable future. And so virtual presents a very viable option from that standpoint. If in this interim moment where you're, really, hey, we're just waiting on the vaccine and really some of this to quote unquote settle down, we can feel more comfortable, but we want our child connected to the school still, then HCS at Home would probably be the most viable option for you, because that would allow you to remain connected to the school and access to things that are at that home school going forward. We heard a lot of feedback, and fortunately able to respond really, we think, in a strong way to the spring. We heard from parents and we heard from teachers and even students that remembering all the passwords and usernames was a challenge and is a challenge. And so we have been able to acquire, in the process of really deploying out, a single sign-on with 1 password and 1 username that will allow access to just about everything that a student has. And so hopefully that simplifies things for our students in HCS at Home and virtual school, as well as the students that are on campus, to really make our operation smoother. So again, just some general reopen information. It is a fluid situation. We are and have acquired some support for through a third party for janitorial service for high touch areas that need to be disinfected and such. In regards to our processes for asymptomatic students and positive cases, obviously we're following CDC guidance, but we'll be publishing some more information hopefully this Friday around that. I just want to be abundantly clear that we knew that there may be some parents that want to opt in HCS at home after the year starts, and that is fine. We do ask that once you opt into HCS at home, you remain there for the semester, and that has to do, has everything to do with staffing a new program, and making sure that we can support the students that are in HCS at home in as intentional a way as we do the on-campus students. And I want to be clear that we absolutely will prioritize HCS at home students as we would a student on campus. Every classroom will have a PPE kit, and every school will receive a COVID-19 kit. And in those kits will be additional masks, disinfectant, sanitizer, the things that are necessary to continue to operate a classroom in as safe a manner as possible. We'll provide masks to students that don't have access to them. The 12th, 13th, and 14th, we are looking to use as orientation days, regardless of what phase we open up in the 17th, probably the 12th being an A day, the 13th being a B day, and the 14th being a remote day to give everybody an opportunity to work through those phases. And again, on Thursday, we will have a medically focused town hall. 31st, I kind of alluded to this. On 31st, we look to publish our procedures for positive and symptomatic cases. Our SAFE pledge is continued to launch. And we will begin to message really strongly, probably beginning Friday, no later than Monday, even prior to August 5th, what we anticipate happening at the start of school. Again, we're trying to see what happens with active cases and are watching that very closely. If you're a parent, if you're a student, we hope that you're taking advantage of the 2020 campaign push that we want to continue learning as much as we can to reduce, mitigate against summer learning slide. Once we're looking to keep students safe, number one. The second most important thing we do is to educate children, and we know that in the summer it's oftentimes easy to disengage, and so we want to keep students plugged in. We've got some incentives and prizes because of a very generous donor that you are able to register for, and your name be pulled, and so we hope that you take advantage of that. Again, just highlighting the virtual town hall on Thursday, the 30th at 5:30 p.m. Again, some medical specific questions can be answered, and we know those are of extreme importance. And then lastly, just to share, on August the 8th from 10 to 1, we normally have our back to school event there at the Tennessee Pavilion, but it will be drive-through focused this year at the First Horizon Pavilion, same location as it has traditionally been, but we'll do it in a little bit different way and still hope to get students ready for the opening of school. So we expect excellence in everything that we do, and appreciate you again being here today to allow us to share a little bit of an update, and we will shift now to answering any questions.
All right, so our first question is, what are the 10 different sites for childcare?
Yeah, I don't know that Justin Robertson is on right now. We will absolutely publish those here in pretty short order. I actually think I have an update. I talked to him earlier today. I think it's going to be more like 14.
Dr. Johnson, I'm on here. It's going to be 15 sites, and that message should be coming out tomorrow.
Right.
All right. So our next question is, why will SACC be taken from current enrolled students for teachers only?
Well, I'm sorry, Jen, can you repeat that question?
The question is asking about SACC and why they're only accepting students that are the children of teachers.
Is that for phase 2, Justin, they're speaking to?
My connection broke up for a second. I got the end of it. Were they asking about, is it just for teachers during phase 2?
Just in general.
So in phase 3, we'll run SACC just as normal. So we'll have 35 sites that have before and after care that will be open for everyone. In phase 2, we'll continue to run those before and after care sites for everyone just like we normally would. The 15 sites that we're opening up all day on the off day, not the off days, on the online learning days, we're going to first open those up to teachers and staff, students, and then from there we'll look at the number of spots that we have open and open those up to our families.
All right, and as a
Well, I did want to add, I think that this is relevant. We and Kate and some others may be able to speak to this too, and Dr. Johnson, even the conversation we were having with faith-based organizations. We are trying to work with lots of different community partners so that families have options. If we're in phase 2, that hybrid learning configuration, it won't just be that school-age childcare is the only available option for families. We're trying to cultivate external partnerships that faith-based organizations may be able to have, and other community-based partners like the Y, like Northside Neighborhood House, Boys and Girls Club, others that may open up to be able to provide full day support to families who need it if we're in that hybrid learning phase. Kate, do you want to add anything to that?
No, I think that's it. It's just we're working on it. We've got some partners who've done a really great job stepping up in the providing this type of support for us. So we're trying to get it together.
Okay, and that answers the next question that I was going to ask. So our next question is, could you address the plan if multiple teachers become COVID-19 positive? How will learning for students in those classrooms change?
Yeah. Well, so first and foremost, we will immediately work to address those individual situations, notifying all families that may be impacted by the situation. Obviously, a school-wide communication will go out. We'll work with the health department, and actually our call just now with our senior leadership team was around this conversation. We'll work with the health department on contact tracing and go through those steps of contact tracing. That school site will probably be closed for at least 24 hours to address some enhanced cleaning and things of that nature. And then based on what we have, or the knowledge that we have in regards to the spread and what's there, based on contact rate, we'll really determine our next steps, right? So obviously, if we're able to, start school right back beyond what we have to do with enhanced cleaning, we'll look at subs or, whatever we would traditionally do with a teacher that's out sick. I will say this, that the ability to be remote has opened up a whole new set of opportunities and options for teachers as well as students, and so I think that more to come in regards to that, but absolutely the learning will continue, and one of the things we talk about is stay at home if you're sick. For our students, we believe that for our employees as well, and again, the students' ability to access curriculum from the standpoint of virtual platforms is going to continue to be enhanced as the year goes out. And honestly, I don't see that ever going away. And so we just continue to operate. It just depends on, what kind of spread are we talking about? 1 or 2 teachers, or are we talking about, 12 teachers in the building? If we're talking about 12 teachers in the building, we probably got a bigger issue that we need to address. And so we just have to work through those individual scenarios as they're presented to us.
Okay, our next question is, if students are only physically connected to a virtual teacher in the mornings, so that they're like having a live interaction with their teacher in the mornings, is there flexibility in their schedule for parents that are trying to work from home and help their students?
Yeah, I think there's some flexibility in that. There will be times where there are synchronous lessons, so live lessons that will be taught, and we definitely want to encourage, because that's a piece of the attendance conversation as well, check in during that time, and that the student's not just checking in but tuned in and accessing. There's a level of flexibility for sure, though, I think, from the standpoint of how you build that day out, beyond any of that live learning that's taking place. And so it's something that absolutely needs to be worked through and worked out at the individual, at the house level, but then obviously at the individual classroom level. Assignments that are online, and I saw Neely's face chime in here. Assignments that are online and are easily accessible can be accessed, beyond that time. Neely, chime in.
Sure, thank you, sir. I think just one thing I would add, thank you all parents for taking the time to be on this call with us, but what makes this so different this time versus last spring when we were closing down is we are in new learning phase. It's a new grade level, new content, new teacher. And so the reason for a schedule that has been shared, the reason for the need for that back and forth of instruction is, especially for elementary, well, for any student, it's all new content. So that demand and that need to access with the teacher is very different. And that would be the case no matter what phase we're in or what plan you chose. So some parents had a lot of different experiences last year, but this year we have to go into the school year with a different point of reference and a different focus because we're in a new grade with new content that hasn't even been taught yet. So I just wanted to add that to Dr. Johnson's point.
All right, our next question is, when can parents expect a set schedule for virtual learning?
For virtual school, I'm assuming is what, is it
I
virtual
think
school or HCS at home?
I think it's probably HCS at home.
Okay. Neely, you want to chime in a little bit more on that?
Sure. We've put out guidance, and even the State Department of Education has put out guidance on what a day could look like. But at this point, from the district level, we have had to somewhat pivot and turn to schools because a daily schedule may be based a little bit more on a school day at your home zone school. And so a day, I can give you like the standard parameters, which the state has prescribed for us, that for children 1st through 12th grade, students 1st through 12th, a typical learning day should consist of synchronous and asynchronous learning for about a 6.5 hour day. Now that might not mean that we'll be like we are right now, all of that time engaged on a computer. And for that purpose, you might be more flexible with the daily schedule. But the school day, our schedules that you may see from teachers are shared at the school level will have to be a little bit more in line with what a typical day would look like. The only exception might be kindergarten, which a standard learning day for kindergarten may be around 4 hours of engagement with either a teacher in a synchronous way or an asynchronous way.
Okay, our next question is for in-person days. So in phase 2 and phase 3, will there be morning and aftercare?
Yeah, I think the full plan, in particular in phase 3, obviously is absolutely, and there will be for both. Obviously, phase 2, it's a little more restricted. Justin, you want to speak to anything else detail-wise with that? The answer is yes.
No, yeah, that's right. So phase 3, it would operate just as it normally does before and after care. The only difference in phase 2 is we add those 15 locations that are all day long.
All right, our next question is, can you give an example of staggered drop-off and pickup time?
For an individual school?
Yes.
Yeah. Neely, you've been a little bit closer to principals in regards to thinking through schedules, so you probably have to give a specific example.
Sure. So one of the things we've been discussing with schools is thinking about their information based on a flight. We've kind of been working with some different companies and different organizations where we're learning. Trust me, I was served as an elementary principal for 13 years, so car lines are a lot of fun. And I know you probably feel the same way as a parent, but what we've been working with schools on is trying to communicate to parents a flight or a block time that parents may come in and then that flight would close down, and another wave or a flight of students would then arrive at a certain time, and that flight would all exit. And so what I mean by a flight or a phase of the way the school opening might work is, if you're in flight 1, you might come in from 8 o'clock to 8:15. If you're in flight 2, your arrival time might be 8:15 to 8:30. And so it's just thinking about how you can get a wave that comes in and get those folks purposefully exited and safe entrance, and a safe exit, so that it's time for another flight or another phase entry. Another program that we are exploring, and as a matter of fact, this was a recommendation from one of our local principals, Miss Gina Johnson, who's the principal at Big Ridge. There is a program that we are looking at that would allow schools to have dismissal, and it would mean arrival could occur in classrooms, not in mass, but dismissal could also occur from classrooms, and not have to, that's where this flight or this phase, but the phases of dismissal would come in. So that is something that we're working with. Of course, buses would have to be somewhat different because arrival cannot be quite as prescriptive, but usually after we get the first 2 weeks rolling, we know about what time our buses will also arrive, and that can be a little bit more controlled at the school level. So principals are working on both sides of arrival and dismissal, one side with buses and then one side with the car lines. So hope that helps.
All right, our next question is, when will families know about school supply lists?
Yeah, so I probably should contextualize what normally is happening right now where we are. So normally at this point of the year, like school schedules are set, have been set for a while, and the focus has been, the focus is the back to school kickoff, and all the lists and such. Candidly, as we've had to give a little more time, and rightfully so, around allowing parents to kind of identify what it is they want to do in regards to return to school. It's really got our principals in a challenging spot to put those schedules together in really short order as the doors, are opening, regardless of whether you're remote or, you're in person or on campus. And so over the next week and a half, there will be more and more information. One of the things I'll share, just even from these conversations that we identified, I think it was last week at the PBS show, as we were taking some calls, we really realized, okay, all the messaging is about COVID-19, and our kindergarten entry parents are really missing the key elements that normally are the headlines right now. Really the COVID-19 has become the headline. And so the list, kindergarten entry, all those things are things that we're dialed in on right now as our principals finish out schedules over the next few days. And then, we'll be in really full throttle by late part of this week. So anticipate later this week, early next week.
Our next question is, when will families know which group A or B their child will be in?
So the school will notify you. And again, that's another 7 to 10 day kind of conversation. One thing I will answer, even though it has not been asked, is they are making concessions for siblings and keeping siblings in the same group to make sure that, we disrupt the parent, that the household is as little as possible. So those are all things that they're working through as we plan.
Dr. Johnson, I will add, and this will start, if it hasn't been communicated broadly yet, the schools have decided, principals agreed that the cohort A would be based on last name A through M, and cohort B would be based on last name N through Z. Schools will determine as to whether or not that is based on student's last name or mother's last name, or parent guardian. So you will get, the only difference is some schools wanted to base it on the mother's last name, while others wanted to just go with the student's last name. But as Dr. Johnson said, if that ends up breaking across different schools for you as a family, that your children would be in different cohorts, we ask that you reach out to the school so that they can make that accommodation to move one child or the other, so that you are all on the same cohort schedule within a household, even between schools. So just keep that in mind. It's going by A through M, cohort A, N through Z, cohort B, and schools will let you know if that's based on student last name or mother last name.
Okay, this question is in reference to the gating criteria. If we are still in the transition category come August 5th, will we open in phase 2 or phase 3?
We need that crystal ball. So I think you've asked the kind of the key question that we're trying to figure out here over the next few days, to be real honest with you. You know, as we looked at these active cases, and I'll let the Colonel or Keith chime in on kind of how we got to the gating criteria, what we're thinking about in that transition moment in time, and obviously, you know, kind of looking at the trends, all those things.
So this is Keith Fogelman, and I'll just way we take just a minute and talk about the gating criteria. One of the things we did as part of the team was really went out and first of all research studies, but also looked at how other people were thinking about reopening schools. And we ran across the idea, I don't think they call it a gating criteria, that's our words, but a similar approach being used in a couple of Tennessee counties, Williamson and Sumner. And started looking at it, talked to our health department, doctors that are on the task force, just to get their point of view about, okay, is this a workable solution? Our gating criteria is a little more conservative than those two counties. We added in our transition phases, and really a transition phase is about we're getting at a point we need to make a decision. So it's a really kind of a decision-making phase and or a transition period that at that point, what we're doing is factoring in other things like what's the trends looking like across the county for positive cases? How many are we averaging on a daily basis? What's happening with our hospitalizations? What are we seeing with ICU patients? And what do we, you know, when we're in school, we'd be looking very similar to what we do during flu season. We're looking at teacher and parent absences. Now, with all that said, the other piece of the information that we'll be working through is understandings, you know, from a health department standpoint, you know, can they see around the corner, so to speak? Can they give us a little bit of a prediction about what we're going to see based on testing, based on things that they will have insight on that we particularly may not have? So we're really trying to look at all those factors and making a decision. But when you think about the gating criteria, what we're really trying to do is make a decision based on information, good data, and try to remove as much emotion from the decision making as possible. We want to keep our teachers, our students, our parents safe, but at the same time, we recognize that school is important. People are counting on us to be in school. We want to do it as safely as possible. And so this gating criteria, looking at active cases, gives us an opportunity to kind of consider the whole, along with those other factors, gives us an opportunity to look at a big picture and make a good decision for what's safe for our students and our teachers and our families.
Right, our next question is there a documented process plan for a positive school case?
Dr.
Yes.
Johnson, I can just keep
Go
going. Just say we're working through, we've actually been looking at, first of all, if we have a case, we'll communicate. We've got a communication tools that's been provided to our schools. We'll be going through some training later this week about how we'll go through notification. We're also working through a process that we'll be able to communicate shortly that gives a very prescribed method for parents as well as staff about if we have situations, how people will come back to school. We'll also, if we do have a positive case, where, as Dr. Johnson mentioned earlier, we'll close down at least 24 hours, if not longer. But we want to go through a process of being sure that we've got the school disinfected. It may be just a classroom that we're really focused on, but nevertheless, be sure that we've done the extra disinfecting, and then we'll do what's safe in returning to schools.
Our next question is, will devices be provided to students in phase 2 if they choose option 1?
Yeah, so we're, obviously our students in grades 6 through 12, have devices. We're approaching a point where we're almost 1-to-1 in grades 3 through 5, and absolutely are committing to, supporting our students that are in. So I need to back up. When you say if we're in phase 1, the simple answer to that is K through 2 is we probably won't be in a 1-to-1 situation. 3 through 12 will be very, very close. 6 through 12, definitely 1-to-1. 3 through 5 will be very, very close. If, to the other side of that question, if the choice is virtual school or HCS at home, we will be looking to support those students in those environments if they do not have access to technology.
All right, our next question is, my children have allergies and often sneeze and have runny noses. Should I be concerned that they will get sent home for sneezing and runny noses?
Yeah, so our commitment is obviously we know that's a real concern that's out there. That allergies. It's in the midst of allergy season, even as we currently stand, and so that's why we are working through the symptomatic and positive criteria that we're trying to get developed. Additionally, also note that our nurses have gone through additional training, and so there will be supports there, to really help with identification and such, if that arises.
Our next question is, how often can we change between the phases? Daily, weekly, bi-weekly?
Yeah, so the cadence we've talked about and floated out there is every 2 weeks, kind of every 2 weeks, kind of seeing where we are. We recognize the difficulty it presents to parents and families to be shifting, every other week or every other day, and we just can't do that. So know this, that the way we've been communicating what phase we're in, really the impetus for that is to really be very transparent and share with the community. We don't foresee being in a phase 2 one day and 3 the next, and then back to 2 and then back to 1 based on active cases fluctuating. We want to kind of get on a 2-week cadence and be able to roll with it for at least a couple of weeks, so that our community knows. I mean, in a perfect world, we're able to get into a really good groove and stay there for a while. So the cases will determine that, but yeah, you don't anticipate in every other day. Now let me be clear. If we get into a situation where, and I'll just throw a hypothetical out there, let's say we went from 800 active cases on Tuesday to all of a sudden Friday, like there was a major outbreak somewhere and we had 3,000 active cases. Well, we might flip the switch there. We may have to shift to phase 1. So don't take me to the bank on that. Again, nothing set in stone, but if the cases kind of move and materialize how they have, we'll be watching those trends and try to allow for parents to plan on a 2-week cadence.
All right, this is the last question that we have. So if you guys have any questions, enter them in the chat box. We'll be on here until 6:30. And this question is, if we were to go into phase 1, are there plans to make sure all students will have internet access?
There are plans in the work. So we are absolutely on the cusp of working through internet access, in particular for our students that are on free and reduced lunch, is where we're kind of targeting our efforts right now, and hopefully more on that in the immediate future. And just I'll give a little more context. We've been working with EPB and other community partners to try to bridge the digital divide. If nothing else, this season has shown that with COVID-19, that there's an absolute digital divide that has to be addressed and rectified. And I'm really proud of the work that our community has done and what we're going to be on the cusp of being able to do.
Okay, we have another question. Is there any consideration for evening school hours for essential workers?
I don't know that I'm tracking. I want to be clear on what the question.
I'm assuming that means that allowing for students to be able to learn in the evening. I would assume this is on HCS at home because they wouldn't, if they were essential worker, they wouldn't be home during the day with their student.
Oh, I see what you're saying for parents. Yeah. So, I go back to the work that we shared initially, which was grace, right? And then to that point, this is a fluid situation. And so, if you've got an isolated case or situation that exist, I would encourage you to reach out to that school and do as I trust you normally do, have very open lines of communication that say, hey, look, I'm an essential employee that works in the medical field, and I've got this or that going on, and our schools, generally speaking, will work with you on your individual situations on a case-by-case basis. So absolutely, we want to support you in every way that we can, and that'd be a school-based conversation to have.
Okay, we don't have any more questions yet, so.
Well, as we take a couple moments here, I just want to say we do sincerely appreciate the time that you all have taken, and just know that there's no perfect answer to this situation. Everybody is trying to really figure it out as we go forward, but also trying to be, for us as a system, trying to be very thoughtful and pragmatic, and include as many stakeholders as possible throughout the course of the process. And we hope that you feel that evidenced, and we know there are still some things to answer, and we're actively engaged in getting those answers as we speak. So again, we appreciate you taking time this evening. Jenny, any other questions?
No, there haven't been. I'm going to put the reopening email address in the chat box
Excellent.
for anybody that has questions after this meeting.
All right, very good. I do want to point out, I don't know everybody on here, but I see two people that definitely jump off the pages to me in regards to engagement. And I see Wayne Brown. I don't see him. I see his headshot here, and legendary Wayne Brown and Dr. Edna Varner, a couple of folks that are definitely and have been definitely deeply engaged in our schools and support of our community. So appreciate you all's continued engagement and being available this evening to hopefully answer a few questions. Again, we appreciate you all. If you have questions, feel free to send them into reopening@hcda.org, and we'll continue to answer those questions as they come. Thank you all very much.